and we will get going. So I'm Lucy Caldwell. I'm a nurse, registered nurse. I work for Carebeans and I'm the nurse advisor. So I kind of do these webinars, help out with the training, help out with the development of the system and that kind of thing. We do these monthly, end of every month, last Tuesday, last Thursday of every month. You can register for any future ones on our website, which is www.carebeans.co.uk. Yeah, so we'll get going with mouth care today. We look at different topics every month and we sort of concentrate really on the care planning side of things. So what to put where in your care plans and what sort of assessments we have available on the system that you can use just to sort of show that you're offering support to your service users. So this can be for the home care environment or the residential setting. Yeah, so it's all sort of relevant. So June, if you've got a question, you've just raised your hand there, feel free to ask your question before we start. Don't know whether you might have done that by mistake. I'm not sure. Sometimes people do. But if you've got a question, speak now. No, I think that might have been a bit of a mistake there with your hand. Okay, so let's get going. So we're looking at mouth care, care planning to support service users. Okay, so what we're going to be looking at today is, let's go on to the next slide. We're going to be looking at sort of common mouth problems, what they may be, what they may look like, how to support service users with good oral health. We're going to be also concentrating on palliative care, so sort of end-of-life care, and the importance of mouth care for someone at the end of life. And then we'll look at care plans and actions and assessments that we can put in place sort of to get everything covered to make sure we're giving the full support to the people using our service. And as I say, I'll hop onto our environment and we'll look at the demo site or the sample site. I'll show you a sample person with some sample care plans. They'll also be in the resource packs, which you will get links to after the webinar. Okay. So, I mean, as we know, supporting patients with regular mouth care is important. It's a fundamental part of care. It can sometimes be neglected, so it's really important that we do offer mouth care, offer support for mouth care when needed. Has been identified that it does sometimes require improvement in the services that we provide for service users. Good mouth care can contribute to good oral health. And of course, good oral health is an important part of general health and well-being. We all feel better when we've got a fresher mouth. Hospitalisation can sometimes be increased and be linked to a deterioration in oral health due to bacteria in the mouth. That can cause things like pneumonia, for example, if bacteria travels into your sort of airway, into your lungs. And it can just contribute to longer hospital stays and therefore increased care costs. So it's important for safety, the safety of service users, and also dignity and the ability to communicate. It's a key element really of compassionate care that we're providing for people. So according to NICE guidance, there is some NICE guidance on oral health that you can Google that and get information on NICE guidance for oral health. They look at statistics regarding oral health and mouth care, and they've identified that tooth decay in care homes is quite prevalent. They say that more than half of older adults who live in care homes do have tooth decay, compared to over 40%, 40% of over 75s that don't live in care homes. So it can be an issue, oral health and mouth care. Poor oral health can affect eating, speaking and socialising. So it can affect people's ability to eat properly and to eat well and comfortably, to speak and to socialise normally. If you feel you've got poor mouth care, you sort of feel like you want to perhaps socialise. So it's a dignity thing. We just look at why older people are at risk of poor mouth hygiene. Of course, we all are, but older people are more at risk for the following reasons. So long-term conditions, things like arthritis, for example, or Parkinson's disease, or people with dementia, they may find it harder to give themselves good mouth care. So, for example, they might find it harder to hold a toothbrush, to actually visit the dentist for appointments, to keep up to maintain good oral hygiene and things like that. So long-term conditions can affect mouth hygiene, as can medicines. Lots of medicines reduce the amount of saliva that's produced in the mouth. So that can leave people with a dry mouth. That is quite a prevalent thing, because lots of medicines do reduce the amount of saliva. And then also natural teeth. So although it's a good thing that people are keeping their natural teeth for longer nowadays with better oral health, but then that can lead to more complex dental care, perhaps compared to people that have dentures, for example. So keeping your natural teeth, although good, can mean more complex dental care is needed. So if we look at assessments and considerations to take in, so it comes to oral health assessments, all people in your service should have, that potentially would struggle with oral health care, should have an oral health care assessment, an oral health assessment when they come into a care home. We've got on the system an initial assessment that you can do, and we've also got an ongoing mouth care assessment that you can do, and we'll look at both of those when we go onto the system shortly. The results of those should be recorded in the care plan as well. So people should have a care plan in place for their oral health, and details of sort of assessments can be linked to those too. So care staff, when looking at care planning for someone with potentially poorer oral health, it's important to ask about a daily mouth routine, so how they usually manage their mouth care, and also what help would they need. So how often they brush their teeth, for example, what they normally do to maintain good mouth care, and what help they might require. That needs to be sort of put into the care plan. Along with dental aids. So what dental aids do they currently use? So it could be a toothbrush, a manual toothbrush it might be. They could prefer an electric toothbrush. They might like mouthwash. They might like to use floss. Those TP sticks we sometimes can use to clean in between the teeth. So it's important to find out what they normally like to use to sort of be able to incorporate that in their mouth health. It's important as well to know whether they've got dentures. And if they do have dentures, they need to be marked with that person's name if they take them out to soak overnight or whatever. So it's just important to incorporate that in as part of your assessment and care planning. And then it's very important to find out information about the dentist. So, for example, when they last saw a dentist, which dentist was it? As well as if they don't have a dentist, how we can help them, to source a dentist. It's very difficult nowadays, isn't it, to source a dentist, but very important that people do have access to dentists where possible. Yeah, so John's just saying here, in Somerset, to find an NHS dentist for patients has become very difficult. Have others found the same? I would imagine that, yes, people have. I mean, I don't know what other people's thoughts are on here or what their experiences are, but I would imagine it is, well, it's very difficult at the moment anyway, isn't it? In the current situation. Yeah, Lynn's saying we don't have any locally in Cambridge, so it seems to be a bit of a UK-wide thing that's, difficulty accessing dentists. Yeah, it's an unfortunate situation, isn't it? But the best needs to be done to get someone access to a dentist or support them in doing so in order to maintain good oral health. So looking at assessment tools still, using a good assessment tool will highlight any areas where someone might need specific care and support. We have one on the system I'm going to show you. You can use it for reassessment. So periodically, you can look into the person's mouth and do a sort of an assessment to see if there's any changes that you might need to action. We have here, and I'm going to send you this in the resource pack as well, this picture, because this picture sort of looks at different areas of the mouth, sort of areas that you should be concentrating on. It might be useful as well just to get a pen torch, the little pen torches, or some kind of light source to be able to look into the mouth to sort of be able to see properly. We can see here on this visual, which I'll send you in the resource pack, that we need to look at the following areas when we're considering mouth care. So we need to look at the lips, the tongue to make sure it's pink, moist and clean, the teeth and the gums. So make sure teeth are clean, they're not broken or they're not loose. Make sure gums aren't bleeding or inflamed. We need to be looking at the cheeks and the palate, so the top of the mouth and under the tongue, just to make sure it's clean, that saliva is present, so it's present with saliva and has a generally healthy look to it. And then also we need to be checking for dentures as well to make sure they're clean and comfortable. So it's important that dentures in the mouth are cleaned at least daily for people. Okay, we'll look a bit more at frequencies later for different people. So it's good to look at the whole mouth, to use a good light source, and to check that it's healthy. Okay, and as I say, we'll send you that in the resource pack, so you'll have access to that. It's important that care staff have knowledge and skills. So you'll be picking up some knowledge today. We'll also have that resource pack. I'm going to tell you about a couple of links as well that I've found useful myself in learning about good mouth care, and I think you might do too as well, especially when it comes to end-of-life care. So care staff need to know how and when to reassess the oral health of somebody and how to support them with their mouth care. So when we're looking at what we need to be doing to support someone with mouth care, it's good practice for someone to brush their teeth daily. So natural teeth need to be cleaned at least twice daily with a fluoride toothpaste is best to keep teeth clean, to keep natural teeth clean. Cleaning products are important for dentures, for example, so it's important to sort of ascertain what their choice of cleaning products is for their dentures, or to recommend cleaning products that you may use just to keep the dentures nice and clean. It's important to know how to clean someone's dentures, so to remove the dentures, how to brush them and remove food debris, and also to remove those overnight and maybe soak those, again, in the cleaning product of that person's choice. Toothbrush choice is also very important. There's lots of different types of toothbrush. Of course, as talking about their choice of toothbrush, what they normally use. Like we said before, that could be a manual toothbrush. It might be electric, battery-operated toothbrush. There's different mouth care products as well that person might wish to use. Soft bristles, there's tougher bristles, and a dentist would probably be able to advise as well on the best type of toothbrush to use. It's important as well for staff to understand about pain and infection, to be looking for those sorts of things. So it's important to understand how dental pain or a mouth infection can affect general health and well-being and behaviour. And if you do suspect that gums are looking red, teeth are loose, there's a smell potentially, it could be that someone's got an infection. If you are unsure, contact the GP for advice or the dentist, because it might be that they can advise on treatments for any pain or infection. So like I said, just reiterating, ask for advice. Make sure your staff, the people in the service, know how and who to ask for advice and to report any concerns that they might have, so at least to a senior within the service, and then they can sort of make ongoing referrals to the dentist or the GP or whomever the appropriate specialist might be. So the Care Quality Commission and other inspectorates, we're looking at UK-wide inspectorates. What do they expect? So they do expect to see evidence of good oral health. So they do expect for you to have assessments in place, initial assessments, ongoing assessments, a really robust care plan, looking at what support you're going to give that person. And it's important for you to take account of nationally recognised guidance. So for example, NICE guidance. So that's the National Institute of Clinical Excellence, NICE. They have some good guidance on mouth care. It's important that you sort of adhere to that guidance. And you need to provide evidence about how you're supporting service users to maintain that good oral health. So it's just demonstrating there that your service is effective and responsive to people's needs. We're next going to look at palliative care, so end-of-life care. Oh, someone's drawn a line on there. We're going to look at end-of-life care, so palliative care. So common mouth problems that might occur during the end of someone's life. So symptoms that we might encounter when we're looking at the health of someone's mouth. This is Marie Curie guidance. that we have listed here for common mouth problems. So common mouth problems in palliative care include a dry mouth. So as we said before, that could be due to medications or taking oxygen or what have you, but dry mouth is very common. Also, people might experience painful mouths, infections, as we said before. If they have got infections, that might lead to bad breath, so halitosis. That could signify infections, but just poor mouth care really can sort of lead to bad breath, as we know. People might have changes in taste as well when they're at end of life, and they might be prone to sort of drooling more. So it's just important to take all these things into account when looking at mouth care. So it's a really important aspect of palliative care in all settings, whatever setting the person's in. And if it's not managed properly, it can affect somebody's self-esteem. They can feel bad about themselves if they've got a poor health of their mouth. It can affect their ability to communicate, socialise, enjoy the foods and drinks that they like. And it can, as we said, cause pain, so therefore affects the comfort of the mouth. So any problems that you do find, as we say, need to be assessed and treated as soon as possible. So we'll just look at some of the causes of these mouth problems, what causes them. So factors that can contribute to mouth problems, as we said, include dry mouth. So that can be caused by medicines. Some people might be prone to breathing through the mouth, especially at end of life. They might be on oxygen therapy, so that might cause a really dry mouth. Dehydration. So, of course, if people are tending to eat less and drink less, they've got a possibility that they might become dehydrated, or they're more prone to dehydration. So that would have caused a dry mouth. Some people might be having radiotherapy or chemotherapy. So especially to the head and neck, radiotherapy to the head and neck area might cause pain and to the head and neck, so therefore affecting sort of oral health. And then medications, as we said, they can lead to a dry mouth, but they can also lead to changes in taste. People might not enjoy their food as much. Mouth or neck cancers can cause mouth problems, and then just general poor oral hygiene. So if someone's weak or fatigued, they're less likely to be able to clean their own teeth or clean their own mouth. So that's where you need to sort of come in and support them with that. So just looking at assessing mouth problems, it's important to ask frequently about any problems that people might have with their mouth. So someone with a terminal illness needs to be assessed regularly. And that's something that you need to sort of judge yourself as to how regularly that needs to be. But they need to be asked frequently if they've got any of the problems that we've just talked about then. Just a quick look at the chat. Okay, thanks, Hayden. They popped your names. Oh, you don't need to put your names down, actually, it's fine. You're all registered once you've logged in, so don't worry, you don't need to put your names in the chat, that's fine. But thanks anyway. So yeah, ask frequently. Have they got any problems with their mouth, or just think about those things that we've just discussed earlier. Ask if they've got any pain. Is it painful to speak? Is it painful to swallow? Can they manage it themselves? So are they able to manage their own mouth care? Do they need some support in doing so? They might need you to do it for them. They might just need some assistance to be able to do it themselves, but it's important to ascertain what and put that in their care plan and provide that support for them. So just thinking about medicines that we talked about earlier, it's probably important to check what medicines they're on, just to see if any of those could be the cause of sort of symptoms. So dry mouth could be caused by opioids, and some people that are on antidepressants suffer from a dry mouth. There's some Parkinson's medications, epilepsy medications, for example. There's quite a few medications that can cause a dry mouth, so it's important to be aware if they are on those, that could potentially lead to that. So just to be mindful of that and be able to manage that appropriately. Chemotherapy and radiotherapy, as we said, can cause mouth problems. That's sort of form of medical intervention there. Steroids, so people that are on steroids. So steroids, reduce the inflammation response. So therefore, people could be at more risk of mouth infections if their immune system is or their inflammatory response is dampened. Bisphosphonates, they're a medication that is often prescribed to slow down bone thinning. So if somebody's on those, they may experience, it's probably because they experience bone thinning. And of course, people with thinner bones might experience damage to the jawbone as well. So again, that can affect how people, eat and drink and what have you, that would therefore affect mouth care. So when it comes to assessing, if it's within your role, you should carry out an examination of somebody's mouth. So when you're doing your mouth care, make sure the service user's got privacy, of course, before you start any assessments on them or examinations. So obviously explain to them what you're going to do, especially if someone's got dementia or might be a bit confused and unsure. Then it's important to explain what you're going to do, and gain consent to do so where you can. So when you are assessing the mouth care for the mouth, you can remove any dentures if possible, because that will help you to assess the mouth more. As I said before, use a torch if possible, so you can thoroughly examine the mouth. Like I said, we look at all of the mouth, the lips, the teeth, the tongue, the palate, under the tongue, just all over really, the lips as well. And as we said, we're looking for signs of dryness. We're also looking for signs of redness when we're looking in the mouth, any bleeding from the gums, for example, or the tongue, any coating of the mouth and tongue. We're looking for ulceration or sores in the mouth. We're looking for infections, so that could include things like abscesses as well in the mouth that become infected. And we're looking for tooth decay, so again, the natural teeth that may be decaying, we're looking for those as well. So if we do see any of those, we would want to alert a GP or dentist to see what action we need to take. So everyone should have access to support for, basic mouth care at the very least every day. And as we said, especially in someone's last days or hours, it's really important to offer good mouth care, and that will probably want to be done more frequently to help keep someone comfortable. And as we always do, we encourage service users to do as much as they can for themselves. But if you need to do it for them, then you do it for them. You might want to sort of advise carers and family members on how to give good mouth care as well, because then they can be sort of actively involved, and that can be a really sort of important part of the support they give at the end of somebody's life to help with good mouth care and keeping them comfortable. So keeping the mouth clean and moist is important. That feels much more comfortable when your mouth is clean and moist. Frequent drinks, so if people are able, then it might help to take frequent small drinks. Of course, if they're able. If someone's not able to swallow, then you wouldn't want to be doing that. But if they're able to take small sips, then it might be a good idea to offer drinks often. Put that in the care plan as well, what sort of drinks they enjoy too. Just thinking about the lips as well. So after brushing the teeth, it's probably a good idea to apply gel, so not Vaseline. Vaseline is obviously used often for lips, for people's lips, to put Vaseline on, but that's a petroleum gel, and that shouldn't be used because, especially for people on oxygen therapy, it's a fire hazard because it's a petroleum gel. So you shouldn't use Vaseline. But it's important to be wary of that when you're looking at what gels to use for someone. So not a petroleum gel, so not Vaseline and other petroleum gels, or other petroleum gels rather. So the avoidance of sugary foods is a good idea, especially in between meals, because that can build up plaque and sort of debris in the mouth. And then when giving someone mouth care, it's important to think about the position that they're in. So make sure they're at least semi-upright rather than lying down. Obviously, that would avoid choking then. If it's not possible, which it might not be possible, of course, to sit someone up, especially if they're at the end of life, then it's important to make sure that fluid isn't building up in their mouth as you give them mouth care. Okay, so very minimal liquids to avoid choking or aspiration, i.e. fluids going into the lungs. So for service users with their own teeth, or for people in your service who do have their own teeth, then cleaning twice daily is with the fluoride toothpaste is good practice. Getting them to spit out any excess where possible. So especially after brushing, if they've got an excess of toothpaste in the mouth, to be able to spit that out, they should be encouraged to do so. Rinsing. So some dentists say don't rinse after brushing your teeth because then it sort of counteracts the good effect of your toothpaste. However, it can be drying and uncomfortable. So for someone at the end of life, if they are able to rinse and if that would make them feel more comfortable, then get them to do so if they're able. So basically it's whatever they feel comfortable doing. So although we might be advised not to rinse after brushing, if it's making them feel uncomfortable and dry-mouthed, then by all means we must get them to rinse if it makes them feel more comfortable. We need to remove partial dentures and clean those separately rather than in the mouth, because then we can get to any debris. As we said before, toothbrushes of different types. Sort of silk toothbrushes, there's baby toothbrushes, so with a much softer bristle. So that will be much easier on the mouth if it's a sort of softer toothbrush. So someone experiencing a painful mouth, that might be more appropriate to use like a baby toothbrush with much softer bristles. And then a non-foaming toothpaste, especially if someone has swallowing difficulties, because that's easier for them to sort of remove that from the mouth or get them to spit that out rather than a sort of foamy, uncomfortable toothpaste. Next, we'll look at people with dentures. So for those with dentures, so we looked before at natural teeth just a second ago and partial dentures, but now for people with full dentures, we need to remove those overnight or assist them to remove them overnight and soak them in a cleaning solution. Obviously adhere to manufacturer's guidelines when it comes to cleaning solutions. That's the best practice there. Rinse dentures thoroughly, so before putting them back into the mouth, so make sure any cleaning solution has come off the dentures. They should be brushed at least once daily, again using a toothbrush or running water, but whatever it takes to sort of get rid of any debris from the dentures. And also after meals, they need to be brushed to get rid of any debris, as we said, and any food that's sort of pocketed in the dentures. You should also check the condition of the dentures when you're taking them out to clean. So by that we mean cracks, any cracks in the dentures. There might be sharp edges. Might be denture missing, for example. So just to check those to make sure they're in a good condition, and also check whether they still fit properly. If someone's losing weight, so it's probable at the end of life, then that will affect how dentures fit. So they might become quite uncomfortable. So again, it's best to sort of seek advice on what to do if they become poorly fitting. It might be best to just remove those completely. Because we don't want someone to be uncomfortable. That's what we're sort of aiming for here, is maximum comfort for that person. So I just want to look at specific mouth problems and how we can sort of deal with those or support people with those. So as I've said throughout, if you've got any concerns about specific mouth problems, speak to the GP or a district nurse or a specialist nurse or a dentist if you're able. But we'll just look at some ways that you can help someone to manage certain mouth problems. So dry mouth, we've mentioned dry mouth a lot, so it's a sort of recurring issue. So obviously that's the feeling of having a very dry mouth. It's often associated with difficulties then speaking, chewing, swallowing. Perhaps people feel they need to keep drinking as well if they've got a dry mouth. It might cause changes in taste as well. Also, people with a dry mouth can develop like a thick coating over the tongue and the lining of the mouth. So that's what a dry mouth can lead to. So to help with that dry or coated mouth, which is quite common, especially in end-of-life care when the mouth can become very dry, it's important to encourage drinks, as I say, where possible. Preferably a sort of cold, unsweetened drink would be the best type of drink. If they're able, sugar-free chewing gum or sucking on sweets, that can sort of stimulate saliva production. Again, if it's appropriate, if they're able to suck on a sweet or chew gum. If not, and there's any choking hazard, then you wouldn't want to be doing that. But if they're able, that might be a nice way to sort of relieve a dry mouth. You can get ice chips, so sort of ice chips if that person's got difficulty swallowing, for example. So if they can't drink, then ice chips, small ice chips in the mouth, that sort of sit in the mouth, sort of just produce a very minimal amount of liquid. Might be a good idea for somebody to suck on if they have an ability to swallow well. Also, you can get saliva replacements or a gel that can help to keep the mouth moist as well, especially again if someone's having problems swallowing. And then also to gently remove coating and any debris. So we can see that on the lips, the tongue, sometimes in the lining of the mouth, and we can remove that by using a soft toothbrush. That's the best course of action for removing any debris. If we just look at end-of-life care, mouth care as well. People, as we just talked about earlier, become less interested in eating and drinking, or aren't able to eat and drink as much as they could. So that's when it's really important to moisten the mouth to keep them comfortable in those ways that we've just said. So if they're conscious, their mouth should be moistened sort of every 30 minutes. That can be with water from a spray or a dropper or ice chips, as we said, in the mouth. Of course, if they're unconscious, you wouldn't want to be putting ice chips in their mouth, but a spray might be appropriate then, or a dropper, or you could do ice chips, but every hour or so. But just being mindful if they're unconscious, not to give them anything with lots of fluid. If someone has a painful mouth, best to seek advice, again, from the doctor or the dentist, especially if they're having radiotherapy or chemotherapy, because that can cause sort of sores in the mouth and cause pain. So painkillers, of course, could help with a painful mouth. And also lozenges. So there's some lozenges that contain like lidocaine, that local anaesthetic. Let's just see, we've got a quick question here. Let's have a quick look. Not sure what that is. Okay, so there's painkillers, so lozenges that can contain a local anaesthetic, sort of has a numbing effect on the mouth. That might be quite relieving if someone's got pain. Also saline mouthwash, again, if people are able to use a mouthwash. Chlorhexidine mouthwash, so that's any mouthwash with chlorhexidine in it. You can get that. That's not a prescription mouthwash. You can get that from, Superdrug or Boots or anywhere. You've just got to make sure it's got chlorhexidine in the ingredients. A lot of mouthwashes don't have that, so just double check when you do get mouthwash for somebody. And it needs to have chlorhexidine 0.2% in it, at least. That's the general percentage that you'll find it. 0.2% of chlorhexidine, and that's a good antibacterial mouthwash. There are also corticosteroids, so topical creams that might be given for ulcers, for example, to treat ulcers. So that might be something that might be prescribed for someone who is suffering from ulcers. Avoiding alcohol, that can dehydrate. Very hot drinks, that could be painful in the mouth. Avoiding dry food, so things like crisps and biscuits. Can you imagine if you've got a painful mouth, that probably wouldn't be a very nice thing to eat, and instead try softer, colder foods, so things like yogurts or custards or chilled soups, for example. If someone has got a painful mouth or got really sore parts of the mouth, you might want to consider using a straw so that those parts of the mouth are avoided, or a teaspoon, for example, so it just avoids irritating sore parts of the mouth. And then drinking and rinsing after eating, that can, as we said, make sure there's no food debris. That could always agitate the mouth. So we need to make sure that we're helping them to rinse after every meal where possible. And also avoiding any acidic foods. Can you imagine if you've got mouth ulcers and you're eating acidic foods, that could be painful. So that's just things to consider with a painful mouth. And all these things that we're discussing can be put in the support part of your oral health care plan. Looking at infections in the mouth. And again, if you suspect that there's an infection, then you need to contact the GP for treatment or potential treatments. So oral thrush is a common fungal infection, and it is especially common in people with a terminal illness. So at the end of life, people may experience this. It looks like thick sort of white patches that are coating the tongue and the mouth. And it can also, if it's in the mouth, it could also mean that it's in the throat and the esophagus as well. So it could be going down quite fast. It really could be quite uncomfortable. So it's important to, the minute you think someone might have oral thrush, so the minute you sort of see those white patches, even if it's just a few, contact the GP and you can start treatment immediately. Thrush as well, oral thrush. Oh, sorry, no, we said oral thrush. Thrush can cause pain, difficulty swallowing and chewing. So again, it needs to be treated. Antifungal tablets is what they'd normally give for that, or liquids or topical mouth sprays, whatever's appropriate for that person at that time. And again, get the GP's advice on that and a prescription. And then cold sores. If people are prone to cold sores, so that's caused by the herpes simplex virus. If people are prone to those, as we know, if we become unwell and we're prone to those, we might be, that we might see that we get sort of cold sores. So that could happen as well if someone's run down or has an infection, or of course if they're at end of life. So again, it would be contacting the GP to get some kind of antiviral treatment if you suspect that someone might be getting a cold sore or has developed a cold sore. No questions in the chat, no? Okay. So other issues at the end of life, bad breath, so halitosis, as that's known as. So people may develop bad breath, which of course would affect your self-esteem and everything, and doesn't feel very nice at all. So it can be embarrassing. It's important to approach it sensitively if someone does have a sort of smell on their breath. And it can be caused by all sorts of different things. Poor mouth care, of course. It can be caused by infections, if abscesses have become infected, if people have local tumours in the mouth, or as we've been saying, poor oral hygiene can cause bad breath. So good mouth care and regular mouth care should improve that. But if it didn't, and there's still that smell, and that could then be indicative of an infection. So again, ask for advice, because it could be that there might be abscesses that you've not discovered or local infections that you weren't aware of. It's important to just get some advice on that. Changes in taste. Service users often experience changes in taste at end of life. They might not want to eat the food that they normally enjoy. So it's important to make sure that they still eat and drink enough, even if it is reduced sort of amount that they're eating. So obviously encourage them to eat what they do enjoy, offer food and drinks that they do find appealing. And as we said before, foods that are easy to eat, sort of cold, soft foods as well. And then people can sometimes drool, so if they've not got the ability to kind of swallow saliva well. It's caused by excess saliva, drooling is. It's obviously often caused by difficulty swallowing. It's common in people with neurodegenerative disorders, so things like motor neurons disease, Parkinson's disease, multiple sclerosis. So people can often have difficulty swallowing saliva. That's when that drooling is caused. So again, contact GP if you're unsure about potential treatments. They may be able to offer something. Also, physiotherapists can help with positioning and suctioning of any excess drooling as well. They can also advise on safe swallowing techniques as well, speech and language therapists. So just be mindful of those specialists too, if someone's got excess saliva that's causing drooling. When should we ask for help? So all those things that we've been discussing, if we are concerned about anything, as we've said, speech and language therapists are there to help, dietitians, that if the person's not eating or drinking enough or experiencing changes in taste, they may be able to advise. GP and medical teams if there's infection, bleeding, pain, that type of thing. And I just want to cover as well, because it's a sort of always a query in these sessions, is mouth swabs. To use or not to use. Safety concerns. Sometimes mouth swabs have been used, or sponges have been used in the past to keep a person's mouth moist or clean. But there have been safety concerns about their use, and that's because the foam head has become detached before it's caused choking. They are actually banned in Wales, foam sponges or foam mouth swabs. So they're not banned in England or Scotland, but they are to be used with caution. They're not recommended, really. I wouldn't recommend using foam mouth swabs. There is actually a very good PDF that's available, so I recommend that you look this up. It's on the Royal College of Nursing website. So if you go to the RCN website, I can show you it as well. Actually, I've got the PDF. I'll show you it at the end. But the RCN website has got lots of guidance on end-of-life care especially, but mouth care, good mouth care. And it's got a lot of useful information about mouth swabs. So you need to check your organisational or national guidelines before using them, or always ask a senior if you're unsure whether to use them. Same with glycerin swabs. People sometimes use glycerin swabs, but they're not recommended because they can cause the mouth to dry. So the glycerin, sometimes they're like lemon glycerin swabs. They've also been used in the past, but as I say, it can cause the mouth to dry, therefore making it worse, really. And also, if someone's got their natural teeth and they're using a glycerin swab, it can cause erosion due to the acidity of the sort of lemon in there. So just to be mindful of those things with swabs. But yes, a very good place to get more information on swabs and general end-of-life care and mouth care is the Royal College of Nursing. If you just put in the search bar mouth care, it'll take you through to that PDF. It's one that I refer to a lot. Okay, so we're going to go on to the system now, and I'm going to just take, in these last sort of few minutes, I'm just going to show you the care plans that we've got, or the care plan that I've got in place. I've actually created an oral health care plan for this person, and I've put a mouth care assessment in place, a mouth care to-do list, and I've put an initial healthcare oral health assessment and a mouth care assessment. So we'll have a look at those now. We'll hop onto the system and have a look. But before I go on, I'll just see if there's any questions, which I don't think there are. So again, we'll have a little session at the end as well. And we're aware of the time. Got about 10 or 15 minutes left. So we'll have a quick look at the system, where we can view care plans. Oh, actually, before I do that, this is the PDF. This is the PDF here. So if you go onto the Royal College of Nursing website, Mouth Care Matters in End-of-Life Care, that's a really good resource to go through, just to give you tips and advice on end-of-life care, good mouth care. It's got some swab information in there as well. Okay, just wanted to show you that because it's a good resource. Benjamin's asking, how do we deal with other medication that may react with calcium or other inhaler? I'm not quite sure what you mean by that. How do you deal with other medication that may react with calcium or other inhaler? I'm not entirely sure what you mean by that, Benjamin, but what I would suggest, if there's any medication issue, the GP is the best person for that advice. Probably best not me for that advice in terms of reactions to medications and certain other medications or devices. It's probably best to contact a GP regarding that. Contact the person's GP just to find out. I wouldn't want to give the wrong advice on that. Okay, so let's get onto the system. And I'm going to show you Sally Webb. And we're going to have a look at what she's got in place. So what I've got here on my care plans for Sally, I've actually created an oral health care plan for her. We've got our 20 standard care plans, and we have a washing and dressing one, so a personal care one. So we could include mouth care in there, but I think it's good to have a separate oral health care plan. I think it's good practice to have an oral health care plan in place with all the support that you're going to give, all your assessments attached, so you can do all your reviews in one place. So for those that do use the system but don't have an oral health care plan in place and have just been using the sort of 20 standard ones, if you don't record it in here, then, and you want to create your own oral health care plan, then you click this plus button here. My system's set up slightly differently with what we call Forms Builder, but I'm just going to show you. If we click onto this, you will get a statement saying create a new care plan. So you would tick on that, and then a little field will come up and it will say name the care plan. So you'll say oral health care plan or oral health and save it. That would then be one of your standard lists then. So when you're doing a care plan on somebody else, you can just pop into that list and you can tick the one that you want to use. We've got lots of random demo names in here, but there we go. I've ticked this and I've used this for Sally. So that now exists in my care plan suite of care plans that I can pull up for Sally. Let's have a quick look. A resident who's prescribed chlorhexidine, but each time we put it in her mouth, she always swallows it. I just want to know if there is no side effect if it is swallowed. Right, so I read that quite fast, sorry. So Kahinda, you're saying you have a resident who's prescribed chlorhexidine, so that's obviously in the mouthwash, but each time we put it in her mouth, she swallows it. I just want to know if there is no side effects if it's swallowed. Right, again, don't look like I'm deferring all the questions, but I would speak to a GP about that. My initial thought about that is that she shouldn't be swallowing that because it's not designed to be swallowed. And I think it would say that on the side of the bottle. Refer to the side of the bottle because it will, I suspect it will clearly say, oh, yeah, Lubna, I'll show you in a sec. Yeah, have a look on the side of the bottle because I think that will say, do not swallow. In which case that's the guideline that needs to be followed, do not swallow. So there may be an alternative that's, I'm presuming that she doesn't, you sort of tell her not to swallow, but she still does. Obviously, if she understands not to swallow, she needs to be told to spit it out, but I'm guessing that she does just swallow it. And is perhaps not understanding that she needs to spit it out. So I don't know whether there will be an alternative. Again, it's best to speak to a sort of GP or dentist about that. So I'm sorry, but can you show again and what we have to sign in? This is what you're showing. Not sure what you mean by that, Lubna, but I'm just going to, I think you might mean the care plan potentially, but I'm just going to sort of continue now with the care plan process. So what I said there was if you click the plus button, you can add a care plan. You'll get a statement saying name of the care plan you want to add. You write the name in there and save it, and then it will be added to your system. So we've got one here for Sally. Oral health. So if I click into that, it's the same as every other care plan. So I'm going to concentrate on the assessments, the care plan that I've put in place, and the actions that I've put in place. So first of all, I've linked in a couple of assessments here. I've linked in an initial oral health assessment. Okay, so this is what's available for everybody on the system, and it's what you should do when they're admitted to your service as soon as possible after they're admitted, as one of their like initial assessments, really. And I've filled this one in for Sally, but it looks at whether they have dentures. If so, what type of dentures? Are they labelled? How old are they? Are they having any problems with their mouth? If so, what? So you can get a picture, really, of what their mouth care is like at present. Do they require an urgent dental checkup? If you said yes to that, it'd say, what action are you taking? When did they last see a dentist? Are they registered with one? And if they are, you need to add it to the contacts list. So I've done that in my contacts list. I've added her dentist. So we have that initial assessment that we can keep under this umbrella of oral health. And we also have a mouth care assessment and record that we can do on an ongoing basis. It might be that I want to do this monthly, weekly, however often I feel is appropriate for the person and their individual needs. So this is a drop-down list. I've done this one already, but this looks at different risk levels with the action that should be taken for each, and you can incorporate these actions into your care plan. So we can do that every month. You can see I've done lots more of these over the months. I've done them every so often. And then in the care plan itself, we're looking at what the issues are. So she's got difficulty maintaining oral health. She gets a dry mouth. The teeth can be sensitive. She's got partial dentures. She's prone to mouth ulcers. So these are the issues with her oral health. These are the goals of where we want her to be. So I want her to maintain excellent oral hygiene. I want her to be as independent as possible. She wants to be as independent as possible. She wants to have her privacy and dignity maintained at all times. So I've put that in the goal. put as many goals in there as we wish, and then I've put some support in place that I've discussed with Sally about how we can meet that goal. So here we go. I've just put some different preferences in here, what sort of toothbrush she likes, how we're going to monitor for mouth ulcers, etc., what lip balm she likes, and all that type of thing. Okay, so that's your care plan. Like I say, you'll get that in the resource pack, an example of that. And then, before we go and look at the actions that I've put in place, I've also done a risk profile here. So you can do a risk assessment. So you can pull up as many risk assessments as you like. I've done one for pain in the mouth, and I've just looked at how I'm going to sort of manage that pain in the mouth because she's prone to ulcers. So I've put a risk assessment in there to keep the risk of, you said pressure ulcers, mouth ulcers low. Okay, so that's the kind of information I'm putting into my care plan to give me a robust oral health care plan, or give Sally a robust oral health care plan. And then finally, we'll look at some actions that we can put in place. Oh, thanks, Lover. I hope that was right, what I just showed you then. You can always message me afterwards if not. Lucy@carebeans.co.uk is my email if anyone wants to ask any questions afterwards. Please feel free if you don't get to on this. Care actions. So this is what I've put in place to support oral health. So I've just put in place a mouth care assessment chart. This is what it looks like. So we'll go into her and we will look at her mouth care assessment. There you go, mouth care charts. It tells me when it was last done as well. I could put an alert on this if I wanted to. I could put an alert to make sure it gets done every day. I could put an alert to make sure it gets done twice a day. I could put an alert on it to make sure it gets done hourly. If someone's at end of life, needs that regular, very regular mouth care, I could put alerts on it. This is what it would do. It would go amber if it's not been done. And then also you can make it go red if it's still not been done after a certain time. So we've got some good alerting in place that will help make sure you keep on top of someone's mouth care. Okay, so let's just hop into this and I'll show you what I've put in place. There is a mouth care assessment on everyone's environment. So if you go into your settings and your reference data management and your checklists, you will have on here a mouth care assessment. It's a mouth care tick list. And I've pulled that tick list through and I've added it to an action. And this is what it looks like. I'm going to go into this. I'm going to click my mouth care tick list. There we go. So I've put this in place, which I say I could time if I wanted to, or if I needed to remind people. I've put some really important person-centered information there, what I want everyone to look out for. And then I've put a tick list in here. It might be that I don't necessarily do all of this. It might be that she declines to have it done this time around. And if she wanted to decline, that's fine. But I can sort of say that I've attempted to do it and she's declined. I can tick the things that I've done or been able to do. I can put any comments in here. So I just tick the appropriate ones. Put any comments in here, mouth looking healthy, or the suspected infection, or she's got bad breath or experiencing pain. And then obviously you verbalise that to the appropriate person, but you can also remind yourself to hand that over, and you can also share that with your manager or whoever's got access to the operations dashboard, and then they can sort of see and take further action, adjust the care plan, make the appropriate referral, etc. And then you can click to say that's done. You can pull up reports on that as well. So you just pop into your service user management or your resident management or your client management. You can look in your detailed report. This is defaulted to the last 3 months. I can have a look at my actions. I don't want to look at all of the actions. I just want to look at mouth care, for example. I generate a report. I can very clearly see what mouth care she's had done, and what's been done and what's not been done, and any notes, okay, which I can print off if I needed to, or save as a PDF. Okay. And that is everything for the mouth care session today. So I hope that's been helpful for everybody. As I say, RCN Royal College of Nursing, that website is very good for further guidance. Sort of cover it, a lot of it. We've covered it today, really, but it's also good to sort of have a look at that too. Just be aware of any national guidance, NICE guidelines, etc. But if there's any questions, I'll hang around for a bit. But my email, if you did want to message me afterwards, if you want a demo of the system, or just have a quick look around, or if there's any existing customers that have got any queries or anything, do feel free to message me. It's lucy@carebeans.co.uk. So Lucy, lucy@carebeans.co.uk. We've got another one on Thursday at 2 o'clock. So if any of your colleagues, you want any of your colleagues to come and join, you might want to come and listen to the whole webinar again, feel free to do so. And it's www.carebeans.co.uk to register for Thursday's webinar and any future ones as well. That's all right, Gemma. Glad that it was helpful. You're welcome. Yeah, as I say, you'll get the recording, you'll get links to the resources, and that will probably be at the start of next week. We'll get these 2 webinars done this week, and then we'll get those sent out to you in one go. Okay, no problems, everybody. Thank you, Lady Lucy. Well, that's very nice. Thanks, Shine. Thanks, everybody. Thanks for joining. Good to see you all. Oh, thank you. That's nice feedback. Thanks, everyone. Okay, I'll just double check that there's no more questions. You're welcome. Okay, thanks, everyone. I don't think there's any more questions. As I say, lucy@carebeans.co.uk. If you want to ask me anything outside of this, please feel free to do so. Okay, thanks, everyone.